Hi, my name is Mark Dwyer. I'm a registered massage therapist here in Ontario, and I use the Dolphin Neurostim in my practice because it helps me get the very best results for my most challenging clients. It is safe, and it is included in my scope of practice. Many people know that soft tissues and muscle dysfunction can cause a lot of the pain that we face, but most people don't realize that nerves are controlling all of those soft tissues. And if those most challenging clients, sometimes we need to go to the nerve level to help their bodies correct themselves. So today we're going to show you how to open and understand your Dolphin Neurostim. So we'll open it up here. You'll see it's all wrapped up. I'm going to unpackage it. And to just get acquainted with it, we're going to start with the on wheel, which becomes the intensity wheel once it's on. When you turn it on, there should be a green light glowing here. When that green light is no longer glowing, it's time to change your battery. We'll come to that in a second. So once the wheel is on, it's on minimum intensity right now, and that's where you're going to want to stay for most applications, especially people who are early on in their treatment plan, or who are very sensitive, or who are reporting pain during treatment. If you want to increase the intensity, you just roll the wheel away from on, and that increases it. I always leave mine, almost always leave mine on very low or minimum, and you're going to get the same therapeutic outcomes doing that. There are workshops and trainings later on that you can take, and we'll show you when and how to change that intensity. So next, we come to the treatment button. We're going to use this big black button to treat points that we locate, and to find and treat some locate some points. We're just going to place the tip down with your thumb on the silver ground plate until you hear the noise become very high-pitched and quiet, and that means you've located an acupuncture point. At that time you can press the button, and that's how we stimulate the acupoints with the Dolphin Neurostim. For most applications, your unit's going to be set to negative polarity and neutral or normal skin type. So, if you encounter any problems with your unit or this light is not on, it's time to change the battery to make sure that that's the reason for any malfunctioning. To open the battery compartment, you can use a key or any coin smaller than a Canadian loonie. That works fine. Smaller coins are a little bit easier. I like to use a key, and the key easily reaches in to pop the battery out. And you would replace the battery like so. And then once you get it to this point, these two bottom clips sit in nicely, and then a firm press, don't be afraid to be firm, closes the unit, and you can confirm that it's working again normally. The light is on. It's in testing mode now. So from testing mode again, we can locate an acupoint by dragging lightly across the skin until the light goes out and the pitch goes up. So let's talk about the polarity on the device. Negative polarity is where you're usually going to be treating. Most of the protocols in any of the books are going to specify that the unit is left in negative polarity. That provides a sedating or calming influence on the body, or on muscles or on nerves. If you want to stimulate or energize a nerve or muscle in the body, you're going to choose positive polarity, the middle setting. That is very rarely indicated in the protocols and in the books. Just look for that. And if you're doing scar release technique, you're going to choose biphasic setting. And that alternates the unit between negative and positive polarity for you. The rest of the time, you're going to leave it in negative polarity. Sometimes we encounter difficulty locating a point. If the atmosphere or the person's skin is very dry, it's going to make it easier to choose dry setting and the skin type button. That increases the sensitivity of the unit, and you will find more areas of low electrical resistance on the skin, more opportunities to press the button. In normal conditions, that can be confusing, but when things are very dry, that's helpful. If it's a humid or moist environment, or there is moisture or massage oil on the skin, you're going to choose the wet setting. That decreases the sensitivity of the unit. You're going to find fewer areas of lower sensitivity opportunities to press the button. It makes it a little bit more challenging to find acupoints if the atmosphere is dry, but you're going to want to use that if the atmosphere is wet or the skin is damp. So once you've chosen the appropriate skin type and polarity for your purposes, you're going to use the unit as a point finder, and you're going to find areas of low electrical resistance on the surface of your skin. And this is much like using a metal detector at the beach. You're going to let the tip, with gentle pressure, tell you when you've found an area of low resistance by watching for that light to go out and listening for the tone to go up. Then you can press the button. Okay, so we talked about how safe the Dolphin is. In fact, it's so safe that it's considered an over-the-counter product. You do not need to be a medical professional to use it. In fact, it's very safe to use even as you're learning to use it, and you can expect pain and stress-relieving results even as a newcomer to the product. These are skills you can develop over time, especially with the workshops in live person and online format, which we encourage you to do. But don't be afraid to experiment with it on yourself and practice. It is harmless and is only going to help modulate your nervous system and reduce pain. The nervous system is the primary modulator of those pain levels and those stress levels. And using the Dolphin Neurostim in my practice makes me feel like I have a remote control for my clients' nervous systems. I found it very beneficial in improving and extending relief between treatments. And we encourage you to try it on yourself. So let's talk about the probe in your new kit. This is the accessory in this bag here on the side. I'm going to unpack it. This probe gives you a little bit extra flexibility and reach. If you want to treat your own back or hard to reach areas of your body, this probe fits onto the end of your unit like this. Do not be afraid to firmly press the probe onto the end of the unit and twist. This is how I apply mine. I am not gentle with this equipment. It's medical grade and it's built to last a lifetime. You want to make sure it's snugly fit. Some of these caps do need to be broken in, applied and replaced several times. If you find that your plug is slipping off too easy, use some rubbing alcohol or a very mild cleaner to wipe the end of your unit and wipe the inside of the cap. And then just press firmly and twist again. Eventually it will stop slipping off. It's also flexible and it helps you reach difficult to reach areas. Gives you a little extra flexibility.